Hi everyone, I want to talk about open angle glaucoma. Open angle glaucoma. And this will take me through the definition of glaucoma. If there's open angle glaucoma, does it mean there's something else? Of course there is, you know. Then what are the possible risk factors? And how can you know that, wow, I'm about having open angle glaucoma? And what are the medications that you have to run away from? And if you're a physician or you're a nurse, what are the telltale signs and symptoms? Okay, with that in mind, let's go. Glaucoma is a collection of ocular or eye diseases that can lead to optic neuropathy and visual loss or blindness. Expectedly, it should be a neurodegenerative condition, and that will let you think that is found only in elderly. But by the time we are done with all my presentations on glaucoma, you will have yourself fully educated that is not only in elderly. There is what we call intraocular pressure. It's expected to be raised in glaucoma, but not in all cases that we will have intraocular pressure being raised. When it is viewed, when the ophthalmologist viewed your eye through their sophisticated equipment, the optic disc will be cupped. But to family members, friends, or yourself, or if you're a health care provider, the first thing to notice when there's glaucoma is peripheral field visual loss. There will be peripheral visual field loss. Okay, that is, you won't be able to see objects coming from the sides, like you ought to do if you don't have glaucoma. Then visual acuity will start dropping, and later on there'll be full blindness. The ophthalmologist or your GP or a family physician will be able to do both peripheral field loss test and visual acuity, and they will tell you things are not working well. Then other tests could be done and the diagnosis could be made and your sight could be salvaged early enough. And glaucoma is one of the leading causes of blindness in elderly. Okay, the increase in intraocular pressure will compress and damage the optic nerve. And when the optic nerve is damaged, transmission to the visual center in the brain is lost. And if this situation is not curbed, is not put under check on time, there will be permanent blindness in the individual. Permanent blindness. Before we start talking more and more, we've been talking about intraocular pressure now. Let's know the normal range, which is supposed to be 8 to 21 millimeters of mercury. Okay, some people are not familiar with the fact that it is not only the blood pressure that you measured using your arm is the blood pressure. It's only pressure. There are so many other areas in the body, intraocular pressure, portal venous pressure, and so on. So in this case, intraocular pressure normal range is 8 to 21 millimeters of mercury. So when that pressure level is taken, if the value is less than 21 millimeters of mercury, you may be fine. But that doesn't rule out possibility of glaucoma, okay? But that will set us on motion if it is high. So if the value is 23 to 24, we are going to repeat measurement. If it is 25 to 29, we'll tell the patient to go, but we'll tell them signs and symptoms of worsening situation when it comes to glaucoma. But if none is showing forth for a whole week, they should come back in 1 week. But if the value is 30 to 40 millimeters of mercury, we have to get a paper and refer to ophthalmologist immediately. But if the value is greater than 40 millimeters of mercury, that is an emergency situation. Glaucoma is the second leading cause of blindness worldwide. It is the leading cause of blindness in blacks. Open-angle glaucoma is affecting the blacks the more, and it's also affecting some Europeans. The angle closure glaucoma will affect the Asians the more and will also affect some whites. The first symptom is peripheral visual loss, like I've said in the beginning, and that will affect the driving. And when it's affecting driving, there's likelihood of road traffic accident, falls, and so on. The differential diagnosis here are all possible causes of red eye. You can check my video to know the possible causes of red eye. I have a separate video already published on causes of red eye. So I'm not going to waste your time going over them right here. Please kindly check my channel for that. What are the risk factors for open-angle glaucoma? Age. And someone will ask me, is it a sin to get older? No. But I'm presenting the facts here. Open-angle glaucoma is high with age in blacks and some whites. So it's a disease of the elderly in blacks mostly, but Europeans are not out of it, so whites are not completely out of it. They can also have it. Like I've just said, commoner among blacks more than other races. Positive family history is a big factor here. So it's genetic, of course, it's ratios, genetic, and all this sort. Diabetes mellitus will increase the possibility of open-angle glaucoma. Hypertension will do the same. And of course, high intraocular pressure. And of course, I've said earlier that having high intraocular pressure is not the only factor. Even people with normal intraocular pressure of 8 to 21 millimeters of mercury could still have glaucoma. We'll explain that later on. High cholesterol. Many people will not want to hear that, but it's a fact. Refractory errors. Yes. Myopia, that is short-sighted. No, I don't mean to be insulting to anyone. And I have short-sightedness. No, I'm myopic. That doesn't mean I'm myopic in thinking. I have myopia. So people like us with myopia, many are using glasses. We could only see objects close to us. We'll not be able to see objects far away or to appear blurred. So we are predisposed to open-angle glaucoma. That is not to say the people with far-sightedness or aparopia should be celebrating. You know what? You are prone to angle closure glaucoma. And of course, endocrine pathology like hypothyroidism will predispose to open-angle glaucoma. In open-angle glaucoma, we could summarize the risk factors into primary and secondary. In primary, we have what is called elevated intraocular pressure, commonly in an advanced age, black race, and even Mexicans are not left out. Positive family history, and people with short-sightedness, that is myopia, who with migraine, headache, hypertension, and some with nocturnal hypotension. The secondary causes of glaucoma could be blunt trauma, penetrating trauma, or past surgery. For example, someone who had cataract and got it removed, that's his cataract excision. It's now coming down with glaucoma. It's likely going to have open angle glaucoma. Uveitis, there's inflammation of the structure there. Steroids is going to scare some people off, right? Eye drops containing steroid, systemic steroids, maybe for chronic obstructive pulmonary disease, for asthma, or some inflammatory diseases like, now you understand inflammatory bowel disease, Crohn's disease, ulcerative colitis, and the likes. Inhaled corticosteroids for some of those situations that I've now just mentioned. Medications causing open angle glaucoma, corticosteroids, antihistamines for allergy, antidepressants. Now, people have depression and we don't want them to go into suicide, and we give them antidepressant, but glaucoma may be waiting at the other end. Decongestants. You just go to the store, you grab your over-the-counter decongestants, to do ephedrine and the rest of that. You may be, on the queue to have open angle glaucoma. Topiramate, what a good medication as anticonvulsant, but there are horrible side effects of possibility of glaucoma. Antispasmodics. How to make diagnosis without swelling? Let me tell you, don't bother your head. Once the signs and symptoms are pointing to glaucoma, either open angle or angle closure glaucoma, just involve the ophthalmologist right away. So that is where the diagnosis will be made, confirmed, and the treatment will begin, and definitive one for that matter. So if intraocular pressure is less than 21 millimeters of mercury, as could be seen in some patients, that is a clue that it is not all glaucoma that will have high intraocular pressure. Okay, some with high intraocular pressure may not even have glaucoma. So what are we talking about here? Just look for the signs and symptoms. Like I have stated at the beginning, the normal values of intraocular pressure is 8 to 21 millimeters of mercury. And when you have 23 to 24, you repeat the measurement. And when you have 25 to 29, then let the individual come back in 1 week and you make your referral. If you are getting 30 to 40 millimeters of mercury, within 24 hours, you have to refer to ophthalmologist. And if it's greater than 40 millimeters of mercury, that's an emergency situation. So ophthalmologist immediately, and intervention must be done right away. What are the possible clinical features of open angle glaucoma? There will be halos around lights. The individual will complain about that, and there will be loss of peripheral vision. That is why when you have your road test done, they will now take you to the point where you're going to look at the visions at the periphery. If you are not scoring well there, you won't get your license. If not, by the time you want to turn right, turn left, and you don't know that vehicle is coming the other side, or you're just driving, you can't see your sides very well. That's peripheral visual field lost. Decreased visual acuity, you'll be able to see less, going gradually. Headache, orbital pain, deep brow pain, abdominal pain, nausea and vomiting. Yes, somebody is saying, why that? Now, I've said it's also possible in people with migraine, okay? Most of the time, glaucoma will be asymptomatic. Yeah, and mostly chronic. So it's going to be there for a long time. And that's why by the time the diagnosis is actually made, it will be at the advanced stage, because the loss of vision is going to be gradual. Now, we're going to see scenarios where it's going to be acute and not in open angle glaucoma. That is going to be acute angle closure glaucoma. Okay. I will end this now. The next presentation will be on angle closure glaucoma. I think you should be interested in that. So kindly check my channel. I will go and make that presentation right now and publish after this one, so that you'll be able to combine the features and then be able to assess yourself or your dad or your mom, your aunt, your uncle, and then as healthcare provider, be able to arrive at conclusion on time. Okay, kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you, I appreciate it.